Welcome to Exam Pharmacy. In this session, we bring you the most important multiple-choice questions, MCQs, for nurse and head nurse exams, specially curated for PPSC, FPSC, NTS, and various government and private job test interviews. Before starting the video, please read the instructions carefully on this page. This will help you get the most out of this session. Stay connected for more videos and updates. 1. A papular lesion is noted on the perineum of the laboring client. Which initial action is most appropriate? A. Document the finding. B. Report the finding to the doctor. C. Prepare the client for a C-section. D. Continue primary care as prescribed. Correct answer, B. 2. A client with a diagnosis of human papillomavirus, HPV, is at risk for which of the following? A. Lymphoma. B. Vaginal cancer. C. Leukemia. D. Systemic lupus. Correct answer, B. 3. The client seen in the family planning clinic tells the nurse that she has a painful lesion on the perineum. The nurse is aware that the most likely source of the lesion is A. Syphilis. B. Herpes. C. Candidiasis. D. Condylomata. Correct answer, B. Exam Pharmacy offers a range of study services to make your life easier, from online quizzes, assignments, and research papers to midterm and final exam prep. Need help? Just message us on WhatsApp and we'll take care of the rest. Let's make studying stress-free together. 4. A client visiting a family planning clinic is suspected of having an STI. The most diagnostic test for treponema pallidum is A. Venereal Disease Research Lab, VDRL. B. Rapid Plasma Reagin, RPR. C. Fluorescent Treponemal Antibody, FTA. D. Thayer-Martin Culture, TMC. Correct answer, C. NTS. Join our WhatsApp group now. Click the link in the description for more study support. 5. Which laboratory finding is associated with HELLP syndrome in the obstetric client? A. Elevated blood glucose. B. Elevated platelet count. C. Elevated creatinine clearance. D. Elevated hepatic enzymes. Correct answer, D. 6. The nurse is assessing the deep tendon reflexes of the client with hypomagnesemia. Which method is used to elicit the biceps reflex? A. The nurse places her thumb on the muscle inset in the antecubital space and taps the thumb briskly with the reflex hammer. B. The nurse loosely suspends the client's arm in an open hand while tapping the back of the client's elbow. C. The nurse instructs the client to dangle her legs as the nurse strikes the area below the patella with the blunt side of the reflex hammer. D. The nurse instructs the client to place her arms loosely at her side as the nurse strikes the muscle insert just above the wrist. Correct answer, A. 7. Which medication should be used with caution in the obstetric client with diabetes? A. Magnesium sulfate. B. Brithine. C. Statol. D. Ansef. Correct answer, B. 8. A multigravida is scheduled for an amniocentesis at 32 weeks gestation to determine the LS ratio and phosphatidylglycerol level. The LS ratio is 1:1. The nurse's assessment of this data is A. The infant is at low risk for congenital anomalies. B. The infant is at high risk for intrauterine growth retardation. C. The infant is at high risk for respiratory distress syndrome. D. The infant is at high risk for birth trauma. Correct answer, C. 9. Which observation in the newborn of a mother who is alcohol dependent would require immediate nursing intervention? A. Crying. B. Wakefulness. C. Jitteriness. D. Yawning. Correct answer, C. 10. The nurse caring for a client receiving magnesium sulfate must closely observe for side effects associated with drug therapy. An expected side effect of magnesium sulfate is A. Decreased urinary output. B. Hypersomnolence. C. Absence of knee-jerk reflex. D. decreased respiratory rate. Correct answer, C. 11. The 57-year-old male client has elected to have epidural anesthesia as the anesthetic during a hernia repair. If the client experiences hypotension, the nurse would A. Place him in the Trendelenburg position. B. Obtain an order for Benadryl C. Administer oxygen per nasal cannula. D. Speed the IV infusion of normal saline. Correct answer, D. 12. A client has cancer of the pancreas. The nurse should be most concerned with which nursing diagnosis? A. Alteration in nutrition. B. Alteration in bowel elimination. C. Alteration in skin integrity. D. Ineffective individual coping. Correct answer. 13. The nurse is caring for a client with ascites. Which is the best method to use for determining early ascites? A. Inspection of the abdomen for enlargement. B. Bimanual palpation for hepatomegaly. C. Daily measurement of abdominal girth. D. Assessment for a fluid wave. Correct answer, C. 14. The client arrives in the emergency department after a motor vehicle accident. Nursing assessment findings include blood pressure 80/34, pulse rate 120, and respirations 20. Which is the client's most appropriate priority nursing diagnosis? A. Alteration in cerebral tissue perfusion. B. Fluid volume deficit. C. Ineffective airway clearance. D. Alteration in sensory perception. Correct answer, B. 15. Which information obtained from the visit to a client with hemophilia would cause the most concern? The client A. Likes to play football. B. Drinks several carbonated drinks per day. C. Has 2 sisters with sickle cell trait. D. Is taking acetaminophen to control pain. Correct answer, A. 16. The nurse on oncology is caring for a client with a white blood count of 800, a platelet count of 150,000, and a red blood cell count of 250,000. During evening visitation, a visitor is noted to be coughing and sneezing. What action should the nurse take? A. Ask the visitor to wash his hands. B. Document the visitor's condition in the chart C. Ask the visitor to leave and not return until the client's white blood cell count is 1,000 D. Provide the visitor with a mask and gown. Correct answer, D. 17. The nurse is caring for the client admitted after trauma to the neck in an automobile accident. The client suddenly becomes unresponsive and pale, with a blood pressure of 60 systolic. The initial nurse's action should be to A. Place the client in Trendelenburg position. B. Increase the infusion of normal saline. C. Administer atropine, IMD. Obtain a crash cart. Correct answer, D. 18. Immediately following the removal of a chest tube, the nurse would A. Order a chest X-ray. B. Take the blood pressure. C. Cover the insertion site with a Vaseline gauze. D. Ask the client to perform the Valsalva maneuver. Correct answer, C. 19. A client being treated with sodium warfarin has an INR of 9.0. Which intervention would be most important to include in the nursing care plan? A. Assess for signs of abnormal bleeding. B. Anticipate an increase in the dosage. C. Instruct the client regarding the drug therapy. D. Increase the frequency of neurological assessments. Correct answer, A. 20. Which snack selection by a client with osteoporosis indicates that the client understands the dietary management of the disease? A. A glass of orange juice. B. A blueberry muffin. C. A cup of yogurt. D. A banana. Correct answer, C. 21. The elderly client with hypomagnesemia is admitted to the unit with an order for magnesium sulfate. Which action by the nurse indicates understanding of magnesium sulfate? A. The nurse places a sign over the bed not to check blood pressures in the left arm. B. The nurse places a padded tongue blade at the bedside. C. The nurse measures the urinary output hourly. D. The nurse darkens the room. Correct answer, C. 22. The nurse is caring for a 10-year-old client scheduled for surgery. The client's mother tells the nurse that her religion forbids blood transfusions. What nursing action is most appropriate? A. Document the mother's statement in the chart. B. Encourage the mother to reconsider. C. Explain the consequences of no treatment. D. Notify the physician of the mother's refusal. Correct answer. D. E. 23. A client is admitted to the unit 3 hours after an injury with second-degree burns to the face, neck, and head. The nurse would be most concerned with the client developing which of the following? A. Hypovolemia. B. Laryngeal edema. C. Hypernatremia. D. Hyperkalemia. Correct answer, B. 24. The nurse is evaluating nutritional outcomes for an elderly client with anorexia. Which data best indicates that the plan of care is effective? A. The client selects a balanced diet from the menu. B. The client's hematocrit improves. C. The client's tissue turgor improves. D. The client gains weight. Correct answer, D. 25. The client is admitted following repair of a fractured femur with cast application. Which nursing assessment should be reported to the doctor? A. Pain. B. Warm toes. C. Pedal pulses rapid. D. Paresthesia of the toes. Correct answer, D. Subscribe to the channel, like, and share. Stay updated with exam pharmacy tips, study guides, and knowledge. As we come to the end of this journey, remember, every step forward is a step toward growth, wisdom, and faith. Keep striving, keep believing, and never lose hope. May you always be guided by light, strength, and peace. Until we meet again, Allah Hafiz.